Hi, my name's Esther. I'm the newly appointed Clinical Director of Digital Pathology Education, which means I have oversight over the Pathology Portal, which I'm going to show to you today. The Pathology Portal is a brand new online educational resource built and developed by the Royal College of Pathologists. It is hosted by NHS England and heavily supported by their IT team. The Pathology Portal can be found here at the learninghub.nhs.uk, and I will show you a demonstration of what we have available. So when you come to the main Learning Hub site, you're asked to sign in, and anybody with an NHS or an academic email address can sign up for the Learning Hub. If anybody doesn't have those email addresses, then we provide support from the Pathology Portal team at the college in order to help support members to get access to the Learning Hub. If anybody already has a login for the e-learning for health platform, then that will work on the Learning Hub as well. So first of all, sign in, and this will take you to the main landing page for the Learning Hub. We're also creating a single sign-in through the Royal College of Pathologists website, so that when people are logged into the college website, there's an ability to click straight through and without having to log in again on the Learning Hub separately. So that will be functional very shortly. So from the main learning page, just scroll down, and when you look at catalogues, here is the Pathology Portal. And you can see that it's restricted access. When you first click on the Pathology Portal and want to access resources there, you'll be asked to request access, and the Royal College of Pathologists portal team will support requests for access. Essentially, anybody with a pathology background is granted access, but it's restricted, so it's not open to the general public. So if we click on Pathology Portal, this will take you through to the main Pathology Portal page. So this is what it looks like. There's a main spine here which lists all of the different pathology specialties that have content at the moment. You can see that some of these have live written next to them, and we have launched parts of the portal that have a good collection of resources. We launched that back in August of this year, and that covers the histopathology subspecialties, main histopathology, also dermatopathology, autopsy and forensic pathology, and cytology and neuropathology. Other pathology specialties, we are working on developing resources for these, and they will be launched officially at a later date when there is a good collection of educational resources. The aim is to produce online resources for all of the pathology specialties that are represented by the college. So if we click on autopsy as an example to begin with, when you open up autopsy, you can see that the resources are arranged by the different bodily systems. There's an introduction section here which is geared more towards those that are not in medical training, or perhaps to medical students that want to learn more about pathology, or particularly in the autopsy setting towards APTs or other allied health professionals that want to learn a bit more about autopsy pathology. If I click on cardiovascular system, for example, we've got sections for heart and vascular cases. And then here we have organisation by levels 1 to 5. And this is a kind of standard organisation that we've got, which roughly represents the levels ST1 to ST5, but also recognises that people work through their own learning at different speeds. Also, in the setting of autopsy pathology, some people will progress through to the certificate of higher autopsy training early on in their training, so maybe even at ST3 level, and at that point they're probably wanting to be working towards the level 4 and level 5 type of cases as they build up their knowledge to be able to sit that higher autopsy exam. You can also see we've got here examples of additional types of resources on here, including the cardiac EQA slides, and they are in here shown as assessments that you can work through and assess your knowledge. So this is a autopsy case with heart histology, and you can see first of all you get some introductory clinical information and some description of the autopsy findings, in this case a hemopericardium and ruptured left ventricle wall through an area of acute myocardial infarction. So here we have a whole slide image of the heart, which you can zoom in and move around and have a look at the features. You can easily jump from one area to another, and it all works quite smoothly. Once you've had a good look at the slide, you scroll down for a bit more information, and in this case we've got a video demonstration which just talks through some of the features and highlights of what you should have been looking at. Here we have something from microbiology, looking at pruritus ani in a child. So we've got a little bit of introduction, some clinical history, and then some questions. And you can click through, answer the question, and then get a bit of feedback about your answer. This particular case carries on onto the next page with more clinical information, investigation results, and further questions that kind of take you through this particular condition. So there's lots of different ways that you can use the portal. So you can just work through the different levels, looking at what you're particularly interested in. So if you are looking at histopathology, you might want to look at breast pathology, and we've got sections for biopsies and resections, and you could just work your way through from level 1, working towards the more difficult cases. Or if you particularly want to see a diagnosis in particular, you can search. So we can search here for, let's say, mucinous carcinoma. And here we've got 10 results. We've got mucinous neoplasms of the appendix, but then also you've got some breast cases and some cytology and ovarian cases mixed in here as well. In terms of the governance of the portal, we have an editorial board and a project board. The editorial team were chosen by an open invitation and an interview process, and we have recruited editors from across different pathology specialties. They include both trainees and consultant level individuals, and they are the ones that have been creating the content and adding it to the portal, and also curating other content that we might find from other sources. They also have a responsibility for making sure that things are up to date, as we know that things in pathology are constantly changing, and the editorial team will retain that overall responsibility. We would also welcome new editors, and there are some particular areas of pathology where content hasn't been created yet, and we would certainly welcome new editors in many different areas. There are also other ways that you can contribute content. We know that many people have, for example, in histopathology, they may have slide collections that they've put to one side over the years for educational purposes. And we can scan those slides for you, and we can create educational content on the basis of your collections. And so we would very much welcome that. And if you have such collections that you would like to share, then please get in touch with the Pathology Portal team, and we can help facilitate that. One of the real advantages of the Pathology Portal is that it's free and easy to access for anybody, no matter where they are, and it has meant that trainees can get access to educational resources in particular fields that might not be so easily available to them locally. For example, there's an excellent collection of neuropathology cases on the portal, which might be not quite so easy to access. We are building content across different pathology specialties, and as those specialties develop a good collection of resources, then we'll be launching in other pathology specialties in the coming months. So please do get in touch if you have resources that you would like to add to the portal. We would very much welcome that. If you would like to be involved as an editor on the portal, then please do get in touch. That can either be directly to me or to Jo Martin, who's the overall project lead, or to the pathology portal team at the college. Simply email pathologyportal@rcpath.org. Thank you very much.